Welcome to Chapter 18, the last chapter of this course that we'll be covering, and this and Chapter 17 will be on your last test. Remember, we don't have a final exam. This last test will be the last test. You'll also have a forum at the end of this chapter to complete as well. So enjoy this chapter on poisoning. It'll be in two parts, and this is the beginning of part 1. So it's good to define what a poison is when we talk about poisons. Poison is anything that can cause harm to an individual if used in the wrong way, by the wrong person, or in the wrong amount. So do know what poisons mean. Toxins, on the other hand, are usually by contact in some way, shape, or form. A poisonous substance is you've come in contact with a poisonous substance produced by bacteria, animals, or plants. So the toxins can change the normal metabolism of cells and destroy them. So know the difference. A toxin is usually by contact with bacteria, animals, and plants. A poisonous substance comes in contact with an individual. And a poison is anything that can cause harm if used the wrong way, wrong person, or the wrong amount. So poisons can be found in numerous types and forms. So when we're talking about a poison, you need to know the type of poison and how it was come in contact with the individual. Was it ingested? Was it inhaled poison? Was it an injected poison? Or absorbed just by direct contact? And then the forms. The poisons can come in many forms. They can either be a solid, liquid, spray, or gas. Really anything can be a poison if used in the wrong way, by the wrong person, or in the wrong amount. But some common household poisons that, people can come in contact with either inadvertently or, on purpose are antifreeze, windshield washer cleaner, medicines, any type of medicine, because of course if it's not prescribed to you and you take it, it can be poisonous to you. Any corrosive cleaners, any lye or bleach or anything with, really toxic materials in it. Fuels, any type of fuels, gasoline, butane, anything. And then, of course, pesticides that we use on our lawns to get rid of, any type of insects or weeds, or even pesticides that we use in the house, such as rat and ant and cockroach type of pesticides. So the first one we'll talk about is an ingested poison, anything that's swallowed or eaten. It occurs when a person swallows a toxic substance. And again, swallowing, you could take a big old gulp of antifreeze, that's a poison. It accounts for over 80% of all poisonings are usually ingested or swallowed. Analgesics account for the largest category, meaning aspirin, anything that alleviates any pain. You could take too much of it. You could take combinations that cause any type of poisoning. Don't confuse poison frequency with poison severity. So poison frequency is what we're talking about in our data collection. Poisoning severity is what a particular poison does and, causes the causing of severe illness afterwards, or actually morbidity. So frequency is the 80% of all poisonings. Not all of them are, take lives, but they do account for the most seen in the emergency rooms and by physicians. So as a first responder, some things you need to look for if someone has ingested a poison or you suspect they have. Abdominal pain and cramping, a lot of times nausea and vomiting. Sometimes they'll be a little bit drowsy, or they might just be outright unconscious. When you ingest something, especially a poison, usually it'll cause burning around the mouth or the tongue. It'll also cause, a foul odor when they're breathing or when they're exhaling. It might even cause a staining. So just be aware of that. Sometimes seizure will accompany, and, in the long-term effects, someone might go into a seizure if not detected early enough. And a lot of times the poison container will be seen nearby, or you'll be able to kind of deduce where it came from. If someone fell out in the yard, they might have accidentally taken a gulp of a pesticide or a weed killer. So it might be pretty close by, so look around. So what can you do if someone's ingested a poison? First and foremost, you need to take in all the information. Try to figure out how old the person is, best guesstimation, and their weight. What condition are they in? Are they conscious? Are they unconscious? Are they breathing? Is their breathing rapid, slow, or very gaspy? What poison was swallowed? Again, try to figure out what they came in contact with, what they drank or ate, and then about when was the poison taken. If you have bystanders, they can say, oh, well, I just saw them drink that just a few minutes ago, or I just saw them 10 minutes ago. And then try to figure out how much was taken. If it is aspirin, you can kind of look at the container. If it's completely empty, you have no idea if it was 1 or 50. So just get a general idea. If the person is conscious, I would still call 911, but while I'm waiting, I would call poison control. The number is on this slide right here, 1-800-222-1222, and follow their directions. If you know what was swallowed, or if they can probably guide you through, how to figure out what was swallowed and give you some information as to how to alleviate it. But I definitely would still call 911 because I don't know what the long-term effects of a particular poison are going to be. If the person is unconscious and you suspect they've ingested a poison, you want to place them on, well, first you want to check and see if they're breathing and if they have a pulse. If not, you start CPR, make sure 911's on the way. But if they are breathing and they do have a pulse, place them on their side, and then keep monitoring, keep checking, make sure 911's on the way. You might want to cover them and just stay really close. Believe it or not, alcohol is considered a poison when taken in the wrong way or the wrong amount by the wrong person. So it can be an overdose or a poison type emergency. Alcohol is a depressant, so it affects person's judgment, vision, reaction time, and coordination. And if someone goes blackout drunk, it can cause death. So you need to be aware that alcohol also can be considered a poison if taken in excess, drank in excess, and you need to treat it as such. So alcohol intoxication, I'm sure this is a review for many of you, but if not, these are some of the things you need to look for if you think someone is intoxicated, especially the odor or smell of alcohol on their breath or clothing is pretty strong. Some alcohols more than others. Unsteadiness, inability to keep their balance, slurred speech, inability to carry on a conversation. Their face could be flushed, and if they are in the later stages of intoxication, nausea and vomiting, and then finally seizures. So the big thing I want you to remember with this is we did talk about diabetic emergencies, and if you look at some of these signs and symptoms, they are similar to that of a diabetic emergency. So you want to make sure, I would ask them, are you a diabetic too? Just to make sure that I was not mistaking alcohol intoxication for any type of blood sugar abnormality in the person or diabetic kind of issue happening. So what do you do if someone's intoxicated? First of all, you want to make sure they don't have any other injuries. A lot of times alcohol can mask any pain or any type of other injuries, or it can make them seem less severe. It kind of dulls your pain sensory. So also check for breathing and treat accordingly. If they are breathing and they aren't having any problems, just kind of monitor their breathing. If they are having problems breathing or unconscious, then that's another problem in itself. Call 911 and make sure you're ready to do CPR. If they are breathing and have a pulse, place them on their left side if they're unconscious, so if they do vomit, it doesn't obstruct their airway. You can call Poison Control Center. I would just call EMS and have them on the way. If EMS is on the way and you want to call Poison Control to see if there's anything else you can do for the victim, that is a good resource for you. Okay, what to do? This first bullet is a little bit suspect in the sense if a person is violent, it says leave the scene. I would not leave the scene. I would call for EMS and the police to come help you. Don't try to, restrain the victim. You might want to talk to them and comfort them. If they do have a weapon of some sort, yes, leave the scene. But if the person is violent, you want to make sure EMS is on the way and provide any emotional support. Assume that an injured or unresponsive person has a spinal injury. So if they are unresponsive and you didn't see them go unresponsive and you think it's alcohol related, they might have fallen and hit in their head. They might have, suffered some sort of injury. Just treat it as a spinal injury just to be safe. If you don't suspect that they have a spinal injury, you can move them to a warmer place, but if they're unconscious, leave them where they are, treat it as a spinal injury. If they are conscious, you can move the person to a warmer place or at least get a blanket to keep them from getting chilled and treat them for shock. So alcohol leads to drug classifications, so meaning that's the next slide. So the drug classifications I'm sure you are aware of are uppers, which are stimulants, downers, which are depressants, hallucinogens, which obviously cause you to hallucinate, and inhalants. So when we talk about the next drugs and the next type of poisonings, keep those four groupings in mind. Sympathomimetics are stimulants, anything that causes an acceleration of the heart rate, any type of your proprioceptors, anything are sympathomimetics. They are often found like in speed, cocaine. Caffeine can also be considered this. A stimulant is any agent that produces an excited state. It could be an excited emotional state, an excited, type of cardiac, breathing, anything that produces an excited state. So what to look for when sympathomimetic use? Any type of disorganized behavior, hyperactivity, restlessness, anxiety or great fear, paranoia or delusions. Some people, there used to be a thing called farm parties where people would put all these medications in a bowl and they would just take whatever they took and not know what it was. A lot of times in that were Ritalin. Some people use Ritalin as a enhancer for studying. These are very, very bad decisions to make because it can cause a lot of other issues, a lot of complications, and it is not something to mess with if you're not prescribed by it. Speed, on the other hand, is the same thing. It's not prescribed. So just be aware of the different medications that can be stimulants, and if someone has access to them, these are the type of signs and symptoms you're going to look for. And this is out of the norm. Some people are hyperactive naturally, but a more heightened sense of hyperactivity or restlessness. Paranoia starts to come in the later usages of it. So what do you do if you suspect someone has taken a sympathomimetic or a stimulant? You want to check for breathing. You can call Poison Control if they are breathing, just to see if there's anything any advice they could give you while EMS is on the way. I would call EMS regardless if it's something that they are it's an excess or their breathing's diminishing, just to be on the safe side. You also want to look for injuries. If they have any injuries that was sustained during the course of taking the stimulant. If they are conscious or unconscious, you want to place them on their left side, make sure the airway's clear, so if they vomit, they won't choke. Provide any emotional support. And if they are violent, again, just like the last slide, you want to, try to reassure them. If they have a weapon or anything, yes, seek safety. Call 911 immediately, have the police and the EMS on the way so they can restrain the person, but try to, stay safe, but also, do it within a reassuring type of manner. Like if they don't have a weapon and they aren't threatening you, just try to calm them down, but stay at a safe distance. Hallucinogens are any drugs that produce changes in mood or sensory awareness. LSD is a big one. Sometimes ecstasy can be considered a hallucinogen, but anything that causes any type of heightened or changes in their mood and sensory awareness. This can make the users dangerous to themselves. They, could walk out into traffic. They could, cause injury to someone that they think is out to harm them. So just know that these are very dangerous drugs, and you should, help with caution. What to look for in instances of someone who's taken a hallucinogen. They will claim to see visual hallucinations. They'll see images. They'll talk incoherently. They usually have an intensity in vision and hearing, meaning everything's kind of exaggerated. What they see might be exaggerated or distorted. You might ask if they have used any drugs at the time, if they have, what they had, if they've injected it or eaten it, ingested it, whatever. Just try to ascertain what it is that they've taken into their system. What can you do as a first responder? If they are conscious, of course they are breathing, I would still call 911 before I would call poison control. Call 911. If they are not breathing, of course, you want to start CPR. Again, if they're conscious and breathing, check for other injuries. They might have injured themselves, prior to you arriving to the scene. If they are unconscious, keep them on their left side. If they're not injured to the point where you can't roll them, provide emotional support. And again, if violent, seek safety. Your safety is number one, but try to calm them, reassure them if you can, especially if there are no weapons involved. Okay, marijuana, hot topic still. Estimated 20 million people use marijuana daily in the United States, either recreationally or medicinally. So with that, you can have cases of marijuana overdose. So with that in mind, not to talk about the legality or if it should or shouldn't be legal, just keep in mind that people can suffer with marijuana overdose as well. Okay, what to look for if you suspect someone has a marijuana overdose. Euphoria, relaxation, or drowsiness. Sometimes to the point, to the extreme, they might not be breathing regularly. It might be very irregular. Short-term memory loss, yes. Impaired thinking, yes. Depression and confusion. Sometimes it can cause an excessive depressive moment for them, and confusion as to where they are, what they're doing, and just for their own personal safety, you want to make sure that, you're reassuring with them. Altered perception of time. They might not be aware of the day or the time of day or, last week, whatever. Anxiety and panic sometimes, and sometimes hallucinations, but not as frequently as you would think. Okay, if you suspect somebody suffered an overdose of marijuana, there are pretty general things that you can do to help them. Again, check for breathing. Check to see if it's absent or if it's irregular or erratic. Call 911 if there's no breathing or the breathing is erratic or to the point where it's not efficient for the individual. Check for any injuries that they might have sustained while under the influence of marijuana. If they are unconscious, of course, place them on their left side so when they vomit that they don't choke. And then, as all the other slides, provide emotional support. Let them know everything is going to be okay. You could treat them for shock. Put a blanket over them if they're okay. If violent, your safety is number one, and then caring for the victim after that.